Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Darren, it's great to meet you, and thanks for joining us on Here for Good.
Happy to be here.
I've interviewed a ton of colleagues, but never anybody that rolled in on a skateboard. We'll talk about that in a minute, but first of all, share with me your role at Virtua. Where do you work and what do you do?
This July will be my 20th year with Virtua and Team Health in the emergency department here at Virtua. Started out initially at Voorhees and moved around to some of the different campuses. I'm the medical director at the Berlin Emergency Department.
The ED at Berlin is a satellite ED. I'm sure that's a little different than when you were at Voorhees at some of the other places. Tell me how the staff works together to support each other, knowing that you may not have all of the resources of a traditional ED.
When you come in the morning, you know your crew. There's one doc, there's two nurses to start, there's a tech, a secretary, and then a third nurse. That's your team for the day. You can have a slow morning. You can have ambulance after ambulance. You just never know what you're going to get. Things change quickly, and we need to be able to recognize when things are and adapt and deploy our resources to the best way in any given situation.
And perhaps the most importantly is depending on each other and recognizing the skills and what each individual brings to the table.
I can be suturing somebody and somebody like, hey, we just got a new one in bed 5. I know you're busy, but, and they just have a different level of like, I'm going to tell them I'm going to start this. And we all know our roles of like, hey, somebody needs to be seen immediately. You need to see this guy next. And so those little lines of communication are
important, but at the end of the day, you know that the patient is getting the best care possible because of the team that you have.
It's true. It takes a tribe. You can't do it alone.
You have been with Virtua over 20 years. You've
almost
20 years. So, I don't want to age, right? Almost 20 years coming up, and you've worked in multiple settings. What is about the culture that appeals to you, that have allowed you to clearly spend a large portion of your career with Virtua?
Virtua has been a great place to work. I found the culture at Virtua, just in patient focused, takes care of her people, and you come to Virtua, you're going to get good care. We're there for the community. We've been there, and we'll continue to do our job. That's what we do.
I understand that you were a professional skateboarder for almost 10 years. How did you become a professional skateboarder?
I did sports since growing up, with traditional sports, baseball, football, wrestling, but one of my friends built a little ramp in his driveway and we just started skateboarding and it just grew. I just started getting better and did some contests. I started doing the National Amateur Series as a teenager. I did well. I finished in the top 10 in the nation, and then that's kind of your calling. Like, hey, there's nowhere else to go. And
well, nowhere else to go. It took you all over the world.
Yeah, the simple wooden toy has taken me all over. It really has. I've been all over the country, all over the world, either competing, doing shows, doing different things.
Any one of those that really stood out for you?
One of the big ones I was very happy to be involved with was the closing ceremonies of the '96 Olympics. I was lucky enough to be one of 10 skateboarders that was invited to really demonstrate to the world all kinds of sports that were really non-traditional.
And you mentioned non-traditional. Is there anything that lessons that you learned from what you applied in skateboarding that apply in medicine and vice versa?
People do well when they try hard things, when they go outside of their comfort zone. Skateboarding's hard. You know what I mean? It's easy to fall off. It's trial and error and repetition and motivation. So if you can fall down 10 times and get back up and have the will and motivation on a skateboard, you can apply that to other things.
I'm sure you've treated in the emergency room kids or teenagers or adults that come in with skateboarding injuries are they somewhat amazed to find out that the guy who's treating them perhaps may have had some of the same injuries or some of the same passion around the sport?
The nurses always be like, oh, they triage somebody and like, oh, you fell skateboarding. Oh, you'll love Dr. Menditto. He'll be over shortly. He skateboarded his whole life. And I often break the ice with people like, oh, you're a man after my own heart. I might show them a picture or two and be like, oh, we'll take care of you.
I know you have 2 sons. Do they share your passion for extreme sports?
They didn't follow me down the path of skateboarding, so to speak. But I was taking both my boys to the skate parks with me really since they could walk.
How old are they now?
15 and 19. My oldest he was almost too young to even skateboard. He would follow me around on his bicycle, and he just started getting better and better and jumping over the little obstacles. And one day we were coming home from the beach and we stopped by a racetrack and we started racing. And now we're in our 12th season of racing. And my boys have competed on a national level. Both of my boys are on the United States team to represent the United States for Worlds.
That's incredible. But my thought immediately goes to your wife. How does she handle having a husband and 2 boys that are passionate about what most would consider extreme sports?
My wife grew up on a horse farm in Harleysville, and her brother is the trainer, and the equestrian where you jump over fences. And so she grew up since she was 3 in a saddle and a helmet, jumping over fences on horses.
What about your colleagues, other physicians and nurses and technicians that you work around? I'm sure it would be hard to know you and not know the love that you have for the sports that you participate in. What do they think about it?
Way back in the days, skateboarding had a different kind of connotation. It was way more counterculture, a little more punk rock. And I remember even when I was applying to medical school, I had a preceptor say, I wouldn't tell them that you skateboarded. They'll think, you're making noise outside of 7-Eleven or something. And I really didn't. I completely disregarded that. And I said, no, I'm proud of that. I had just been invited to participate in the closing ceremonies of the Olympics, give a show to the world as sport, as art. And that really was the seed for skateboarding to become an Olympic sport, which it is this year.
Yeah.
It's something I've always been proud of. And my letter to admissions was ambassador to a sport wants to become an ambassador to the human body. And so I embraced it. Like, hey, I traveled around the world meeting people and skateboarding, and I want to kind of apply that same passion to medicine, and so I did the opposite. I embraced it full-heartedly, and
I'm glad that you did, because honestly, that's what this podcast is about. It's about being here for good, and you were able to take a passion, something that you committed a lot of time and energy to, sort of translate that into what you do today in providing care for people that need it. I think it's wonderful. Well, clearly you have what I would consider fearless family and lots of success to your boys. And it's really been a pleasure to speak with you and learn about sort of what drives and motivates you and how you commit to taking care of our patients in this community. So thank you for being a part of Virtua. Thank you for sitting in on Here for That. And really appreciate everything that you do.
Thank you very much. Thanks for having me.
Well, it's been great. And if any of you have any ideas about going out and skateboarding, I'd ask you to reach out to Darren first. But otherwise,
give me a lesson.
A lesson for all. Thanks for joining in for yet another great edition of Here for Good, the Inside Edition.